Hello, everyone. Dr. Rich Castellano here, the Smile Doctor. We're here today with Linda. Linda, thank you so much for letting us do a teaching video for today. And today we're doing a little bit of the Belotero for the lip wrinkles, and we're also doing a lifting procedure for the neck and jawline. So you can see for her before pictures that we're going to tighten up the neck and jawline there. And for this video, we're going to be doing some of the fillers. So those lip wrinkles that we see right on top and a little bit in the corners of the mouth, we're going to fill in there. Belotero is a great filler, and the hyaluronic acid, they're great fillers for the fine creases. So what we're going to do now, we'll just zoom in up close so you can see what we're going to do. And my team has everything set up perfectly for us. So Linda, how long have you been thinking about having the lift done for? You said you came out to one of our seminars.
I actually just decided to do it when I came with Pat.
You weren't thinking about doing it when you came to the seminar.
No, I was going for liposuction, but yeah, when Violet showed us all the procedures and stuff, I decided to do it too.
Okay, so what I'm going to do first is a cleanse on the lip. This is the HIBA cleanse. So, and now that you know what your options are, it's pretty exciting what we can do. Because you're very healthy, you have many active years ahead. And when we look good, we feel good, we do good. That's our motto here. Okay, so a little cleanse on the skin, then I'm doing the numbing. And what I use, this is the 1% lidocaine with 1 to 100,000 epinephrine. So you see that's a 32 gauge, very, very fine needle there, okay? And so this is a dental block. I use this little buzzer. I'm going to lift your lip here, and as you can see, from the middle tooth, if I count 4 teeth over between the 4th and 5th, little pinch, 1, 2, 3, pinch. I'm looking for the infraorbital foramen. You feel a big pinch, little pinch, or not too bad? Not too bad, Linda? Okay. If you need a break, you let me know. I'm not in a hurry. So I approach where the foramen is, and because I like to also do a little bit of a field block and numb a little bit in the area around it to help more completely numb with the lip. Little pinching through there, little bit. Little pinch here, 1, 2, 3, pinch. Because of course the lip is very tender. I do the same thing on the bottom for the inferior orbital foramen. Pinch, 1, 2, 3, pinch. And then I will also inject medially into the sulcus, which helps to numb the lip. And we're doing the melolabial fold, a bit of the smile line. You doing all right? Everything's looking good, so we give our patients, for the procedure, we do a little bit of the Valium, and then we also, can you read if there's comments that come up there? Can you unplug the blood pressure cuff so that I can just, thank you.
You're welcome.
Thank you. So I'm going to lift the lip here, counting 4, between the 4th and 5th tooth, pinch on 3, 1, 2, 3, pinch. You feel big pinch, little pinch, not too bad there?
Not good.
Pinch. It's a little tender. And pinch. Same thing here between the 4th and 5th tooth, pinch for that V3, the 3rd division of the trigeminal, or the coming out of the inferior.
How long does it take for the numbing to start setting in?
Mental framing, rather. Mental framing. The numbing sets in right away. Now, do you feel a little bit of a pinch through here, a little pinch? Or not really? Now, how about over here, little pinch? Little pinch here? You'll feel a pinch here, 1, 2, 3, pinch. That's a little tender. So I'm going to go specifically in the corner of the mouth. We get the downturn of the mouth. Everything's looking good. Pinch, 1, 2, 3, pinch. All right, pinching. Now over here, do you feel a little bit of a pinch? Little pinch or not really? How about over here, pinch?
Little.
Pinching over here?
Little.
So it's pretty well numbed, and she might feel a little bit of a pinch, but not that much. So right now, we're using the This is the Belotero. Hello, Dr. De La Rosa. Hello, Tammy. And that's the Belotero on a 30 gauge needle. Okay.
I'm a big baby. Can I be put to sleep?
We can give extra Valium and relaxing medicine. So, do you feel a little bit of pinching through here? It's kind of a sideways. Do you feel a little pinch there, Linda, or not really?
No.
It's kind of a sideways injection because you want to go into the thickness of the skin, and you're almost reinflating the skin. And I can see it just plumping as I inject. Hyaluronic acid is a substance that's naturally found in our body. Of course, the thing that we do to our face that looks most attractive is always our smile. Nothing looks as good as our smile.
So
And
she's tough.
She is tough, but you don't have to be tough for this because the numbing medicine makes it much easier. Sometimes it is worthwhile to come back for a second session of the hyaluronic acid to just reinflate and plump. You never want to go too far. It's always better to come back another day and do more rather than go too far. So this is just for the superficial creases. You feel a little bit of a pinch here?
Mm-mm.
And the lips are sensitive, so I do prefer the dental block. Inferior alveolar nerve, mental nerve as it comes out through here through the mental foramen, inferior orbital foramen, infraorbital nerve, and then that's the first, second, and third division of the trigeminal. You feel a little bit of a pinch? Little pinch here?
Just a little.
How about here, pinch?
Mm-mm.
And I like to massage it vigorously just to make sure that it smooths out nicely. You feel a little pinching here?
Mm-mm.
So, as I tell patients, you don't make it perfect, you want to make it better, make it as good as you can. If you want more improvement than what the filler can do, then we talk about the laser resurfacing, but that does require more downtime, so the hyaluronic acid is a very popular option.
This filler is for wrinkles around the mouth.
Wrinkles around the mouth. You can use this filler anywhere. It's a good filler for lip plumping as well.
Hello from Marisol.
Hi Marisol, how are you? We've set our date, mark the calendar, 10/26/2018. That Friday is our next 3-day live event. ppmdlive.com for practice profitability. You'll be at the Tampa Convention Center, so make sure you're marking your calendar. And we'll be in Vegas later to do teaching on our technique and helping to teach doctors do a better job with their patients. You feel a little pinching here?
Someone says hello. I can't read that name.
A little bit.
So we can soften some of these creases through here, and then the hyaluronic acid does absorb some water later, which is, you don't want to taste the chocolate cake before it's done baking. It doesn't taste that good yet. You feel a little pinching through here?
Mm-mm.
So I'm trying to do it right into the thickness of the dermis, and you may see a little bit of the product. Pinching there.
Hello from Florida.
Hello and welcome. Thank you for watching. Feel a little pinch here. So now I'm going to build that corner of the mouth. And the lift is also going to help us. So the combination is what we're looking for. Thank you for watching. For those of you just joining in, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here today with Linda. She's doing a little bit of lip filler. We're going to be doing a lift for her later. And we showed you her before pictures. We'll show you again. The goal is to get a subtle improvement in the lip wrinkles. Can't make them gone. We want to make them as good as possible. And Belotero is a great filler to do that. All the hyaluronic acids work very well for this type of goal. And we're just plumping the dermis where it loses its elasticity and it wrinkles more from sun damage and aging changes. You can already see some of the creases settling. We chase as many of them as we can. Perfect.
Someone says she looks pretty comfy.
How are you feeling, Linda?
Good.
Everything's looking good.
You're doing a good job, Doc. You're the best.
Thank you. You get the hang of it after a few thousand. We do a couple hundred syringes of filler every month here. I don't know anyone in town that does that. It's very difficult to be as good as someone that does 10 times as much as what you do. So that's why patients, what they're looking for, they want someone who does a lot of this thing, this area that we're treating, the fillers, the facelift. So that's what we do. Thank you for watching. You can download our book on Amazon. We guarantee we can make you look younger, and the Smile Prescription. And if you're a physician or a student that's watching, go to our website, Practice Profitability, little pinch there, practiceprofitabilitymd.com, where we teach doctors and students how to run their business so that they can do better with patient care. If you do not have good business training, your patient care can suffer. So that is an important part of being a great doctor, is understanding the business behind delivering great healthcare service. Everything's looking good. How are you feeling, Linda?
Okay.
She's tough. We try and make it easier than getting a tattoo. Perfect. Okay. So I like what I see so far. We're making some nice progress. It still looks very natural. It's not overdone. People are very sensitive with the lips because they don't want to, nobody wants the duck lips. They don't want to look done. Okay, I'm just looking for the last few areas that we'll just fill a little bit of this crease here. Just a tiny bit here and there. I love to fuss over the little details.
Someone says I earned my wrinkles and I'm very proud of myself. People are vain.
Well, so that's a good point. People talk about vanity. So what happens with vanity, big difference between vanity and style. If you use your appearance to put down other people, that's called vanity. But when we use our appearance to make ourselves feel good or make other people feel good, that's called style. And style is always in style. Do you have the mirror, please? So we're all done with the filler. So
Nina
why don't you take a,
says-
Linda, why don't you open up your eyes? Can you see how it fills in some of those creases?
Oh, yeah.
Right, so it doesn't make them perfect, but it's a big difference from where we started. And then I'll show you her pictures from before. So we're done with this part. We're gonna start with her lift in just a moment, but you can see from her before pictures, see the creases in the lips there, and now we've been able to soften those quite a bit. The Belotero can last, some people say a year, some people say 6 months. It's variable, depends on the person, but that helps. See you later. Bye-bye.